What is a cervical screening test, and do I need one? A cervical screening test is used to check to see that the neck of the womb, called the cervix, is healthy. The test looks for any abnormal cells in the neck of the womb, which if not treated, may turn into cancer. Abnormal cells may be unhealthy, so screening is a way of helping to stay healthy. All women aged 25 to 49 are invited to have cervical screening every 3 years. All women aged 50 to 64 are invited to have cervical screening every 5 years. If you do not understand any of this or would like it explained more fully, please ask. Should I have a cervical screening test? There are some things that may increase the risk of getting cervical cancer. Having unprotected sex can increase the risk of cervical cancer. Using a condom will help to protect you inside and will protect you against getting infections. If you have ever had sex, you should think about having cervical screening. Smoking is bad for your health and can also increase the chance of getting cervical cancer. The best way to protect yourself is by having cervical screening. You can talk to your practice nurse, doctor, community nurse or health facilitator about this, or about whether you need to have a test. Ask if you're unsure. An invitation to have a cervical screening test. If you are 25 to 49 years old, a letter will be sent to you every 3 years to tell you that you need to make an appointment for cervical screening. If you are aged 50 to 64, a letter will be sent to you every 5 years. When you receive your letter, you must decide if you need to go for the test. Remember, smoking and having sex, or if you have ever had sex, may possibly increase the risk of developing cervical cancer. Cervical screening will help to prevent cervical cancer. If you do not understand or need to ask for help, you could ask your local practice nurse, community nurse or health facilitator. To arrange a cervical screening test, you will either need to call your local surgery or community clinic to make an appointment. Your community nurse or health facilitator can help you with this. At some community clinics, you do not need an appointment. A cervical screening test is used to check to see that the neck of the womb is healthy. The neck of the womb is called the cervix. The test looks for any abnormal cells in the neck of the womb, which, if not treated, may turn into cancer. Abnormal cells may be unhealthy, so screening is a way of helping to stay healthy. Usually the screening test will be done by a practice nurse or a woman doctor. You can ask for a practice nurse or a woman doctor to do your test when you arrange your appointment. A screening test cannot be taken during your period, so you must plan your appointment around this. You can arrange to visit the doctor or practice nurse before you have the screening test. They will explain what will happen when you come for the test. Your community nurse or health facilitator can help you to arrange this. They can also help you to understand what having a cervical screening test is about. Going for a cervical screening test. A cervical screening test is used to check to see that the neck of the womb is healthy. The neck of the womb is called the cervix. The test looks for any abnormal cells in the neck of the womb, which, if not treated, may turn into cancer. Abnormal cells may be unhealthy, so screening is a way of helping to stay healthy. The test can be done by a doctor or a practice nurse. This will be at your local surgery, well-woman clinic or community clinic. The receptionist will check your name and appointment time and will ask you to sit down in the waiting room until the practice nurse or doctor is ready to see you. When you go for your cervical screening appointment, you may take a health worker, friend or a relative with you for support. The doctor or practice nurse will call you to a private room where they will talk about the test with you. Your health worker, friend or relative can be in the room with you for support. You'll need to undress from the waist down, removing shoes, tights and knickers. It would be better to wear a skirt than trousers, as you'll be able to leave this on. There is normally a curtain around the area where you will need to undress. Once you've removed these items, you'll be asked to lie on a couch. You will be shown a small instrument called a speculum, which is used to carry out the test. You can handle the instrument if you like. When you're ready, you'll be asked to raise your knees so that the speculum can be inserted into your vagina to hold it open. This may be uncomfortable and feel strange, but it's not normally painful. You must try to stay as still as possible. Again, when you're ready, the practice nurse or doctor will use a small, soft plastic brush. The brush is wiped over the neck of the womb to pick up a few of the cells. You will feel a small amount of pressure inside, but it's over very quickly. Try to take slow, deep breaths and relax, as this will reduce any discomfort. The screening test takes about 2 minutes. When the practice nurse or doctor has finished, you will be asked to get dressed. You will be told when to expect your results. You will receive your results by letter. If you do not understand or need help, ask for support. Receiving a normal test result. You should receive your test results in the post. If you are aged between 25 and 49 and your test results show no unhealthy cells, you will not be invited for another test for 3 years. If you are aged between 50 and 64 and your test results show no unhealthy cells, you will not be invited for another test for 5 years. Invited back for another test. You may need to make another appointment to have another screening test. It's important that you do go back to see the practice nurse or doctor so the test can be done again. Or you may need to attend a special clinic for a different test called a colposcopy. This is done to see if you need any treatment, and you will receive a letter telling you where you need to go. A colposcopy is a simple test of the neck of the womb, carried out by a doctor or specialist nurse. It lets them decide if you need treatment. If you do not understand, or if you need help, ask for support. If you're on your period around the time of your appointment, you should call the colposcopy clinic to see if you can change the date. If you're unsure why you need another screening test or where you need to go, ask the practice nurse or doctor. Sometimes a cervical screening test shows some cells that may not be healthy in the neck of the womb. If this happens, you may be asked to go for a special test called a colposcopy to see whether treatment is needed. A colposcopy is a simple test of the neck of the womb, carried out by a doctor or specialist nurse. It lets them decide if you need treatment. The test only takes about 15 minutes, but you should allow at least 1 whole hour for the visit. If you would prefer a female to do the test, you can call the clinic to ask for this. If you need any support or help with this, please ask. When you arrive at the colposcopy clinic, the receptionist will ask your name and address. You can take a health worker, friend or a relative with you. The doctor will see you first to ask you some questions and to explain what tests you are about to have and why they are needed. You will then be asked to get undressed in a private area. You will need to undress from the waist down, removing shoes, tights and knickers. It will be better to wear a skirt than trousers, as you will be able to leave this on. The colposcopy nurse will help you to position yourself on a special type of couch. The couch has padded supports for your legs. When you are ready, the doctor or specialist nurse will gently insert a speculum into your vagina to hold it open. This is the same instrument used during the cervical screening test. This may be uncomfortable and feel strange, but is not normally painful. You must try to stay as still as possible. After this, the doctor or specialist nurse will look at the neck of your womb using a colposcope. This is a special type of microscope that is like a large magnifying glass but looks like a large pair of binoculars on a stand. It lets the doctor look more closely at the neck of your womb. This does not touch you or go inside you. The doctor or specialist nurse will look at a screen to help them carry out the test. You can look at the screen if you like. If there are any unhealthy cells, the doctor or specialist nurse will take a small sample of cells from the neck of the womb. This is known as a biopsy. You may feel a slight stinging feeling, but it should not be painful. After the test, you will be asked to get dressed. You should feel well enough to continue with your usual day-to-day activities. If you've had a biopsy, you may need to return to the clinic for your results. If you have not had a biopsy, sometimes you will be told the results straight after the test. The doctor or specialist nurse may be able to tell you what is wrong and if you need any treatment. Staff at the colposcopy clinic will explain everything to you when you go to the clinic. They will make sure that you know when to expect your results and how you will get them. You might get treatment on the same day, or you might need to come back. If your test results are okay, you may not need to return to the colposcopy clinic. This will mean that you will continue to receive your invitation to attend for cervical screening. If you would like any help or support, please ask. Your practice nurse, doctor or health facilitator will be happy to help.